recently at Summit, we hired a registered dietitian, Dr. Jennifer Bowden, who also actually has a PhD in nutrient delivery to the discs in the lumbar spine, and she's been fabulous. And she has helped us to become more current with the recommendations regarding practice guidelines for preoperative nutrition. So I want to just describe what our recommendations and practice guidelines are at Summit for preoperative nutrition. The first practice guideline is in the weeks before surgery, at least in the several days before surgery, is to try to consume 25 to 35 grams of protein per meal. I think if you're thinking just about protein-dense foods like meats and other kinds of protein, eggs, milk maybe, and whatever, maybe a protein shake, anything that you can do to increase your protein intake in every meal going up and leading into surgery. You also want to increase or make sure that you're taking complex carbohydrates in the several days before surgery. We know that long distance runners and triathletes and other kinds of athletes, they load on carbohydrates before their activities. Why wouldn't you, as a patient going into a surgery, which in some ways has very much a similar thing, consider some of these nutrition things that the athletes do? The other thing that's important before surgery is to increase physical activity. We want the body to be as primed as possible before the operation. We recommend that you eat up until about 8 hours before surgery. I think that it's probably safest to stop eating whole foods after midnight because the surgery schedule can change. But having good nutritious meals up until about midnight the night before surgery is recommended. And then you want to drink clear fluids up until the time you leave your house. The recommendation is to take clear fluids until 2 hours before surgery. And if you're doing that until you leave your house, I think it's very unlikely that you would leave your house and be in the operating room undergoing anesthesia any sooner than 2 hours. We recommend that the patients take 45 to 50 grams of oral liquid carbohydrate. This is a little bit more than what's found in Gatorade. There are some products on the market that have this content of oral carbohydrate loading, and I think we'll have some more information about what would be most important and what's available out there. Another one is to have in that drink 9 to 12 grams of essential amino acids, particularly from whey protein products. This oral carbohydrate loading and essential amino acids has been shown to improve lipid metabolism, increase well-being, decrease the inflammatory response from surgery, decrease insulin resistance by up to 50%, and also improve the comfort and may actually decrease the pain that the patients experience. So those are our practice guidelines. I would welcome any patient that's going into surgery to consider meeting with Dr. Bowden and her team in consultation to understand what would be most appropriate for their particular situation.